So yeah, my name is Robert Kariuki Wanyahoro. I'm here with Dr. Patrick Gatonga, the CEO of AAR Insurance. And we're going to ask Dr. here a few questions with regards to his journey on the insurance space. And we're going to get a few insights of what has been the challenges so far and what you enjoy most with regards to being the CEO of such a big insurance company. So Dr. on to the first question. Given that AAR is a brand to reckon with in the insurance space in Kenya and beyond, so what could you say has been the journey has been for you in terms of what sets you aside in terms of competitive advantage and what makes you be the brand you are today?
So, speaking of AAR Insurance, we have been in existence for 9 years now. We'll be celebrating our 40th anniversary next year.
Amazing.
And it's been a truly enriching journey for us as an organization.
Okay.
Coming from initially a rescue company, used to be Africa AR Rescue.
Oh.
AR.
Yeah.
We grew to be a health maintenance organization, clinics. Then around just after 2010, separated the insurance business from the healthcare delivery business. That's the clinics.
Yeah.
But you see, it's still one large entity at the end of the day.
Okay.
So on the insurance business, we've seen insurance industry grow.
Yes.
It's been a very active contributor to that growth within the country.
Okay.
And especially in health insurance, where we do a lot of business. And health insurance is not a very old industry in Kenya.
Yes.
It's an industry that's still growing. We believe it still has a long way to go.
Yes.
And you can tell this just by looking at the number of people who have health insurance protection across the country. It's very
true.
And most of those are formally employed people.
Yeah.
So as AAR Insurance, we've seen the industry grow from insuring primarily employed people to starting to insure SMEs, individuals, to increase the coverage that we have within the country.
Okay.
And we're looking forward to being an active and even more active contributor in the next phase of growth of our insurance industry, not just in health insurance, but also insuring other assets within the country. Right now we have close to 300,000 people that we actively cover across East Africa.
For the medical cover?
Medical as well as the other asset class. So in Kenya we provide more than just medical insurance. We cover other assets, personal assets, domestic assets. We provide solutions like WIBA, personal accident solutions. And we're looking to grow protection. Our vision is to ensure that every household within the region is covered in terms of health and wealth protection.
Amazing. Thank you, Dr. Hari. So maybe, if I may ask, what will you say your market share is in the Kenya market? If you can give a some figure.
So within the Kenya market, our mainstay, as I said, is health insurance.
Yes.
Where we have a market share of just about 13%.
13%, okay.
We also provide general insurance coverage.
Okay.
When you look at how general insurance is classified by our regulator, the IRA, we fall under general insurance coverage. So if you look at the entire spectrum of general insurance, we have a market share of about
5%, okay.
And that's what we are looking at to actively grow.
Amazing. That's quite commendable. So maybe what are the challenges you mostly face in the industry, given that you have a lot of competitors? I know
challenges as AAR Insurance are not too dissimilar from what the industry faces.
Okay.
One of those is the appreciation of insurance is an important
aspect of
solution
life.
Or an important aspect of life.
And
it's an important aspect of protecting wealth and as an important aspect of also protecting the health of people.
Yeah, true.
We believe we have a lot of work to do, not just as AAR Insurance, but as an industry in general, to grow the awareness and to also demonstrate the value of insurance by making sure claims are paid. We pay claims religiously and on time. And it's a practice we want to continue to make sure that it's felt. So people really feel the value of insurance. I think the other general challenges that we have taken up is to understand the market more, so that we develop more tailored solutions for market. Insurance, in its very strict form, came as an imported product. So we have a lot of work to do in terms of adapting it to local realities. If it's things like health insurance, adapting it to the local
customizing
patterns, really customizing it to the local market. The other big challenge is that we are working to resolve is to bring the right technology. We believe there's a lot of value technology can bring in. First of all, to make it much more easily accessible. People from anywhere across the country can be able to buy it easily. But also that the services can be delivered in a more seamless way. Customers can interact with us seamlessly. That we can use this technology to also manage some of the more, some of the bigger issues we face in the industry, like fraud. We believe technology is a big solution to unlocking.
Or maybe in the same breath, I've seen you've recently launched an innovation hub. So maybe what are some of the innovations that you can say are milestones towards growth of the brand in the recent years?
So we've you're right. We recently launched the innovation hub. Where we are sitting is one of the
amazing. I can see that.
Of the innovation hub. And the reason we launched it is because we believe innovation is fundamental to being able to create more growth within the insurance industry. But also within that, provide more tailored solutions. It requires a lot of new thinking, a lot of experimentation. So the hub we've created is actually to assist us to do that, to have a dedicated team that is sits in within very specific conditions, and that the team is enabled to create and test out solutions and roll them out. The hub also brings partners together. So we invite different partners from within insurance, out of insurance, to be collaborators with us to create these solutions. So for the time we've had the hub, which is about 2 or so months, we've actually created a solution that is now available in the market. It's a very interesting solution targeting long distance travelers. And we started by piloting on the route of Nairobi Nyeri. So if you travel that route now, we collaborated with one of the circles there. Also in collaboration with one of our partners, technology partners, MTBA. If you travel on the 2NK circle, one of the options that will be offered to you is that as you buy your ticket, you can buy insurance for what that insurance solution affords you is that you can then, in the event of an accident, there'll be immediate evacuation from the accident site. One is taken to the nearest hospital. And once they get to the hospital, they don't have to pay. They're stabilized, and there's proper communication then that happens from there. The idea is to reduce the number of fatalities, accident fatalities, as well as disabilities that come out of long distance travel. So the very small fee of
40 shillings. Did you say 40 shillings?
10%, about 10% of your
fair cost. Wow, that's quite amazing. I never thought of that. I should maybe take a trip to Nyeri and see how that works.
There are many travelers. So every year there are at least 5 million travelers.
Wow, along that route.
When you think of it, the mobility industry is
a huge industry by itself.
And there are many accidents that come out of that.
True.
So we believe we can actually make travel much safer. And that will contribute to meaningful economic growth, but also protect families whose family members are traveling.
Exactly. True. And prior to this, do you need to be a registered member of MTIBA, or how does it work exactly?
No, you buy it instant.
Oh, it's an instant thing.
As you buy the ticket, you buy the cover as well for the duration of the travel.
Quite interesting. Quite interesting to know that. So maybe on the other bit, I'll say, so looking forward at AAR, where you come and your journey and where you want to be, where do you want, as CEO, AAR to be in the near future? Maybe I believe the intent is to be the market leader, if you're not yet, but I know you're along those last phase. So what you'll say, how do you envision AAR to be in the near future? Yeah.
So for AAR, we have purposed ourselves to really redefine insurance.
Okay.
And in that, deliver our vision of making sure that every African household is protected. Their health is protected and their wealth is protected. We see a big need to protect African households, beginning with our own neighbor, East Africa, beginning with Kenya, Tanzania, Uganda, and making sure the households there, as people, we're in a developing economy. So as people try to grow well, as people start businesses after finishing school, try and make a living, as their wealth grows, that issues of illnesses, and other challenges that confront them don't take them back.
Exactly.
So we believe there's a huge need for that to happen in this continent. And as an insurance company, we've taken that as our obligation. So what we are looking to do in the coming years is to actually make that a reality, to increase the coverage. Of course, as a business, we believe by doing that, we'll grow our market share, we'll grow dominance in that. But our real purpose is to make sure that we can be able to make sure that more and more families are covered. And that as people grow themselves and prosper their families, prosper their businesses, the risk incidents like
are mitigated.
Health illnesses and other issues don't
put them back. True. Yeah. I mean, it's more about the impact you want to make in people's livelihoods and elevate them.
Exactly.
All right. So maybe this will be a bit personal question. Maybe given that you are from a medic background, how did you get passion, gain that passion to venture into insurance, all the way to being a CEO? What maybe word will you give to the young people there to show them that yes, you can be, a CEO of a different career path than you took initially, and what is it that you're so passionate about in the insurance industry?
So it's an interesting question. I think for me it was I followed my heart. I continue to follow my heart. And that's the advice I would give to anyone. You're right. I trained as a medic. I really enjoyed it. I enjoyed it. I actually taught at the university. I used to be a tutor in human anatomy. But every time I went back to the hospital, I would always feel like there's a bigger problem that I could solve. People would queue. Over time, it became quite clear to me that I needed to keep trying. And following my heart. How else can I address this problem? Seeing people queuing, coming to the hospital, and I think one of the things that struck me the most was the issue of financing. People would have to do halal days, they didn't have insurance, and it would all go back to financing. We looked at why, in many cases, why a procedure was delayed because there was no money available. We looked at why a diagnosis was late because the person couldn't go to hospital because they didn't have money.
Means and transport,
so I more and more became interested in understanding the financing solution. Initially, I went into management consulting, so I worked with McKinsey, which helped me to understand the business in a good level of detail. And I think it's in the course of that I felt I could make a contribution to insurance. And I decided to combine my knowledge of business and health insurance. But I believe financing in itself in general is still a big challenge that we can face, that we need to
embrace
for the African continent. Because once people have finances, they're able to bank money and protect what is banked. Then it's very easy for them to do other things. It's very easy for them to go to hospital when they fall down. It's very easy for them to raise capital and find other means to improve their livelihoods.
True.
So I personally believe that as Africans, we must also. This is also our time now to build real African solutions.
True.
I think we've learned a lot from the rest of the world. We see that we've gone through a lot of case studies. We've studied how the world works.
And
I believe it's time for us to actually solve the problems that face us as Africans. Because nobody else understands it better.
Exactly. I mean, that's quite commendable. And I love the fact that you've embraced. It doesn't matter what background you are in, as long as you have that, passion to impact and finding an innovative way of doing that. And this is true, for example, providing medical covers and like the transport and TIBA platform you mentioned. That goes a long way in terms of how, as Africans, we perceive insurance as an industry, as a cover, and how we can embrace it. It's not something that I believe how Africans view it is something that is an extra cost to you, or it's a burden. It's not a burden per se. It's something that you can be able to mitigate risks quite conveniently as you progress without having to suffer all the risks associated with certain aspects of life.
Exactly. And you see, insurance is if you think about it, insurance is the only solution. Where if you take the example of traveling between Nyeri and Nairobi, you pay 40 shillings. But in the event of an accident, you're covered to about 150,000.
Wow, that's impressive.
It's the only place you put in a little money and get a lot
in return. Exactly.
The only thing is that there's a risk it may happen or it may not happen. But from what we've seen, you're always better off.
It's better to be safe than sorry.
Exactly.
Very commendable. So thank you so much, Dr. That is all I had for today. I don't take much of your time, so it's an honor talking to Dr. Patrick Gatonga. Thank you so much, and looking forward to I want to go and test the Handbook platform and see how it works, because that I think it's very much scalable. It's quite innovative from my seats. That will be very interesting to test. I try it out. Yes. Okay. I'll test it out. And thank you so much for your time. I appreciate it. Thank you so much.